Hi, everybody, and welcome to this webinar about how to make your eyes whiter and boost your confidence. Because a lot of times when we have whiter eyes and we get the redness treated, the discolorations treated that have really been weighing on us, a little bit like an albatross or like a monkey on our back, what we find is people have a huge boost in their confidence. So we're going to talk about all that. We're going to talk about the procedure, and let's just get started. So a little bit about us is that we are located in Beverly Hills, and we've been doing this procedure for almost 20 years now. So we've got patients who fly in regularly, literally from all over the world. And this is a map that we have in our office. And when people come in from out of town, they actually take a little pin and they can put it in the city that they're from or the country that they're from. And it's a nice little tradition that we have here, but it does really show that people travel here all the time, every month, every week, from literally all over the world, because this is my specialty. And speaking about me, my background is for the last 27 years, I've been a cornea and anterior segment specialist in terms of eye surgery. And I've pioneered a number of procedures for the cornea and also for the conjunctiva. And I've been an FDA investigator, and I've published many, many studies and given many, many presentations. So in fact, I've given over 276 lectures now, and also published 55 studies in peer-reviewed journals in the medical journals, and authored 4 medical textbooks on eyes and eye surgery. So this has really been my passion for helping people and also educating people and educating other doctors around the world, which is why I speak at meetings and I publish so much in the literature. Let's talk about the discolorations of the whites of the eyes. And what we know from listening to people just like yourself is that a lot of times people are really suffering because when they have discolorations on the whites of their eyes, whether it's the bloodshot eyes from the sun exposure for years and years, not wearing sunglasses. Most people, when they're younger, their parents almost never tell them that it's really important to wear sunglasses. So as a result, they're outside for decades and the sun starts to cause their eyes to become bloodshot. And then people think, and then they comment perhaps like, are you tired? We're going to talk about some of that, but we definitely know that people are suffering and it's a psychological effect and it's real. I mean, people sometimes just socially withdraw because they feel so self-conscious, or if there's a brown spot on the white of the eye, people are tired of hearing like, what's that on your eye? Is everything okay? You got to get that checked out. It just makes people feel very self-conscious, and it's natural. So one of the things that a lot of times people will hear are these types of comments, especially when people have bloodshot eyes. Did you not get enough sleep last night? Are you on drugs? Are you doing drugs? Are you smoking pot or weed? Or are you just up late partying? So over the years, it just really grinds down on people. And we know that because we hear this from people all the time for so many, so many years. And traditionally, the treatments are these types of drops that get the red out. Sometimes people are treated with steroids and artificial tears. If there's dryness that's causing the red eyes, then treating the dryness can help the red eyes. But usually that's where it waxes and wanes, and sometimes the eyes are perfectly clear, and when they're red and irritated from dryness, then people usually know that. But we're really talking about chronic discolorations, and of course, if there's pigmentation, people have darker skin, have more likelihood to get these freckles or tan spots on the whites of their eyes that don't go away, unlike a regular tan. More melanin in the DNA, which is in the skin, is also more melanin in the conjunctiva or the white of the eye too. And of course, these types of drops, Lumify, Visine, they're not going to do anything to change the pigmentation or if there's yellowing as well. So that's where this procedure that we call WhiterEyes, technically it's called WhiterEyes conjunctivoplasty, comes in, where we're actually being able to treat those discolorations and improve it. And that's what we've been doing for many, many years now. It's a specialized procedure that helps make the eyes whiter and brighter by removing most of the unsightly red veins and yellow or brown areas in the conjunctiva. And when we're treating red bloodshot eyes, we actually don't want the eyes to look too white because our eyes need enough blood vessels to keep the surface of the eye healthy. So we don't want people looking like a cartoon character. That means there's not enough blood flow, and that can actually cause some problems by making them too white. So we want them to be in the normal range. And after the procedure is done, the body will regenerate a new membrane, a new conjunctiva with typically a normal amount of blood vessels. And that really is why we can make the eyes whiter and then help people feel more confident about how they look and appear. So I want to give you some examples. These are really quite representative. You can see on the top the before and the after, somebody who had chronic bloodshot eyes. And then afterwards, you can see how they look really nice and white and bright, very alert. And I can tell you this patient in particular was someone who had become so self-conscious about his red eyes. He had socially withdrawn to the point of not even going out. And after we did the procedure, he actually came back, and at his 5-year check, he said, because of this, I had that confidence I could go out and start dating again. And now I'm actually married. Subsequently, he actually now has a child. And so he has a family, and he literally attributes that to having this procedure. So it's really life-changing in many different ways on different levels for people. There's another before and after pictures below, just showing some more of the redness there and how it looks a lot improved, gaining more confidence through that process. So of course, the natural question, and myself, as I mentioned, for the 27 years, I've been an eye surgeon specializing in the cornea and the conjunctiva. Do we need all these extra blood vessels? Because for me, safety is always number one. It's paramount. Safety is first. And after something's safe, then we can look at the cosmetics of it. But the answer to the question of do we need all these extra blood vessels, the answer is no. Because if you look at babies and young children, as shown here, they have blood vessels. They're a little hard to see, but they're not excessive. So you don't need all the excessive blood vessels that develops from the sun damage over time. And it's really, as I mentioned before, that combination with the sun exposure of the UV light, the ultraviolet light, from the sun that causes this reaction. And that's also what causes the pigmentation, as I talked earlier about, from sun exposure, like those freckles or tan spots. So one thing, if you're not doing already, that you can do to help yourself, or if you're a parent and you have children, always get in the habit of outside wearing sunglasses. Please, just if you can just take one thing away from this webinar, wraparound sunglasses particularly are the best kind because they block the side from the sun hitting your eyes. Some sunglasses are better than none, of course, but the best are the ones that hug your face, they wrap around. And even adding a hat on top of it blocks even the sun coming on top too. And since we're talking about UV protection, I should mention that we actually did a study, 2 studies actually, many years ago, where we tested the side windows of many cars, even cars that came with a factory tint. And we found that the UV protection from most tints even is not sufficient in cars that are from the factory. We published this study, and many of the cars that we tested on factory lots of car dealerships were insufficient. So know that if you really want to be also covered while you're driving, have people put a film on the side windows, not the windshields. Those are covered already by law, federal law, about 96% of UV blocking in the windshields. It's a clear film, as you know, in the windshields that blocks the UV. So you don't have to have a tint to have UV protection. And conversely, not all tints have UV protection. So if you're going to put a film on the side windows, at least in some states, it has to be a clear film, not tinted. But that's additional protection when you're driving because there's more cataracts on the left eyes of people because that's by the driver's side window. And in Australia, when we did our research for our study, it's the opposite. They drive on the opposite side of the road in Australia, and there's more cataracts associated and more skin cancer on the right eyes. So more skin cancer and cataracts are on the left eyes associated with that driver's window on the side exposure. So everything you wanted to know about protecting your eyes from the UV. So, okay, here's another set of before and after pictures. And this patient had the redness too. And the before and afters below, you can see some of the brown pigmentation on the whites of the eyes. This was somebody with darker skin. They had more melanin, and the ultraviolet from the sun caused the pigmentation to come out. And then on your right side, you see the after pictures. So these can be very dramatic improvements that people can experience. So what are the indications for the WhiterEyes conjunctivoplasty procedure? Number one is excessive blood vessels, and number two are brown spots, and which we call pigmentation, and some people refer to them as freckles. Number three are yellow growths, or spots that are yellow on the whites of the eye, also called pingueculae, and that's also from sun exposure. And pteryium, which are these red fleshy growths that grow onto the cornea and can even cause vision problems and vision loss. And lastly, there's a condition that is very rare, but because of my specialty, I see a lot of people coming in from all over the world, is nevus of Oda. One eye they're born with has pigmentation on the sclera, the white of the eye, deep down, and we can actually improve the cosmetics of that and treat the pigment essentially. So just another set of before and afters here, just giving you a sense. And you can see in the top left, it's very red. This is almost like where it's going to eventually become a pterygium that would grow under the cornea. And we were able to do a really nice improvement, again, even after 4 weeks. And I'm going to talk about the recovery in a moment. So basically what we're doing with these procedures is we're removing the damaged conjunctiva. And it's a painless procedure, usually takes about 15 minutes to do. And I'll talk about the recovery as well. But typically it's easier than getting your teeth cleaned at the dentist. That's what people say routinely. Now here's an example of a pigment or freckle on the white of the eye. And this is where people are not even getting relief from Visine or any of those other get the red out drops because they cannot do anything for pigmentation. It's like basically a stain. So you can see the after picture, very dramatic improvement. And what's nice about the pigment is this pigment, once we treat it, it is instantly gone. People look in the mirror and they see that pigment, the brown spot, just immediately gone. So that's something that's super exciting for people to see when we treat that. Here's another example of a before. You see the pigmentation there. And if you look kind of carefully, I'm going to show you with my mouse, but there's even a little bit of pigment right there underneath it. And then when we look at the after, we actually took care of that little pigment that was right below it too. So wherever there's pigment, we can go after it and be really successful with treating it. This is a much more dense pigment spot. It's gone. It's just gone. And this is 1 month afterwards. So people have just been super, super happy and very ecstatic about the results. I want to show you one of our patients, Jamal Crawford. He is a NBA basketball player. And here, his before picture, you can see where he had some pigmentation. And he's going to discuss his experience.
It's Jamal Crawford, LA Clippers. I was having some brown pigmentation in my eyes, and I had it for years, and over the years, it continued to grow. It's very frustrating. I started noticing it more in pictures and noticing it more on TV when I would replay the game. And I started looking up different procedures to kind of take care of that if it wasn't, something that was life or death. And I found Dr. Brian. It was an eye bright procedure that I had. It's unbelievable. I recommend it to anybody. It's as easy as going to the dentist to get your teeth cleaned. I thought I would be nervous. You don't want anybody messing with your eyes. So I had to find the best, and he delivered. I was really, really happy with the procedure. Coming back now, my 3-week checkup, things are smooth. Things are really, really good. I'm so thankful to Dr. Brian for getting this done. I truly couldn't have done it without you. I recommend this to anybody. Thank you, guys.
And it's interesting, he even used the same example that it's easier than getting your teeth cleaned at the dentist. So it's really how people feel about it. I know there's some natural nerves to having the procedure and going through the process, but as you know, even hearing from somebody like him, it's just, easier than you think. It's much easier than you think. So here's some examples of people who were treated for excessive blood vessels. So you can see on the left, there's a lot of this blood vessel vascularity here. And here we really have cleaned up a lot of those excessive blood vessels. Another example, of a lot of blood vessels that made the eyes look reddish and pink. And the 2 months afterwards, they're looking really nice. And just another example here as well. And now we're going to talk about that condition I mentioned before called a pterygium. A lot of doctors will treat a pterygium using a graft. And the thing about a graft is that it can cause vascularity to come back or blood vessels to come back. So even though it can treat the actual pterygium on the cornea, but the redness may not be relieved on the white of the eye when using a graft. So that's why with the WhiterEyes procedure for many, many, many years, we don't use a graft. And that's why we can get results that look like this here, which look great, and people are, again, very high satisfaction level with it. And I will say this, that using a graft even has a fairly high recurrence rate of a pterygium with a different technique. With the WhiterEyes conjunctivoplasty, our pterygium recurrence rate is hovering about 3 to 5%, so exceedingly low. Here's another example, and here you can really see how this pterygium has grown almost right into the pupil area here. So this is the whole extent of the pterygium, and now this is with it being treated 1 month afterwards. And this is where someone had a pterygium done somewhere else, and they started to have it regrow here, and it was red too, and the patient was very concerned about the cosmetics of it, even though the pterygium was no longer on the cornea. So we actually could do the WhiterEyes procedure even when people have had previous surgery elsewhere for either pterygium or other conjunctival issues too. And pingueculae are those yellow growths that are on the whites of the eye, and that's what's shown here. And this is a pingueculae that's actually starting to become a pterygium. You can see it's beginning to grow onto the cornea, but it's still yellow here and has that vascularity, and this is what it looks like afterwards. This is another pingueculae where you can appreciate the yellow here and here, and afterwards we treated the yellow, and the yellow is gone. Another pingueculae here and here, and again, we've got nice results here. Now here's that rare condition called nevus of Oda. So you can see how dark it is. Now, this people are born with. Imagine being a young child, and a lot of times people are getting teased about their eyes because unfortunately kids tend not to be nice in some situations. And we can really make a huge improvement in the cosmetics by treating the pigment here. And here's another example below of nevus of Oda, and here it is afterwards. So again, huge boost of confidence for people when they have these procedures. A lot of times doctors will go into the operating room, like a surgery center, to do these procedures. Well, we don't do that because we have a procedure room right in our office, and it's an office-based room, and we do all of our procedures here. So we don't have to go into a surgery center. It's just the room that's part of our office here in Beverly Hills. So it makes patients very comfortable. And there's no anesthesiologist there running IVs in their veins, and no needles and things like that. So we do it right here where it's very comfortable for people. So what's the healing recovery like? Well, I'm going to sort of break this down by type of condition. So when we're talking about someone being treated with the WhiterEyes procedure for excess blood vessels in pterygium or pingueculae, there's going to be some redness in the eyes for about 3 to 4 weeks. And then at that point, it really starts to clear up really nicely, as you saw from some of those pictures we just went through. So even like 3 to 4 weeks, it's already starting to turn the corner and look quite good. And then typically healing is fully completed at 3 months. When we're treating a pigment or freckle on the white of the eye, as I mentioned, those spots are immediately gone, and there's redness for a much shorter period of time, only about 1 to 2 weeks. And depending on the extent of the pigment, sometimes there can be a little recurrence in some areas, but nothing like originally. And most times it never recurs. But I still like to always mention that because I can't control the DNA. So we can treat the pigment, but I can't control the DNA. If I could, I'd get a Nobel Prize, I'm sure. But I always mention there's a small chance a little bit of the pigment could come back, but most times it doesn't. And for nevus of Oda, the improvement is just very significant, even the very next day from that. And there's really not much redness when we treat nevus of Oda. So possible side effects. Well, overall, I have to say that I'm not aware of anybody having anything really serious happening in terms of going blind, but there can be some stinging and burning for the few days after the procedure. For some people, there could be some light sensitivity, which is typically temporary and short-lived. It's very rare to have something called scleral thinning, But that's why we want to make sure people are healthy, they don't have autoimmune diseases or anything like that. We have a questionnaire to go through that, and it's important that people fill that out properly so we understand exactly their medical history if there is one. There is, like I mentioned, sometimes a little bit of recurrence in people who have darker skin, and we can always do a touch-up if there is pigment that recurs that's on the significant level. We can always do a touch-up. I know you have a lot of questions, which is natural. So that's a good reason to get the book, How to Improve Your Life with WhiterEyes Eye Whitening. It goes into a lot more information, a lot more details about the procedure to help you really get full information, which is why I wrote the book and had it published, because we want to provide good, solid information so people have a good resource. And that's the way I've always been. I've always been looking at myself, not just as a doctor, but as a information provider for people in the public, which is why on social media, for example, I have almost 3.9 million followers because of providing good information across TikTok and Instagram and YouTube. You can get the book right here, so you can pull out your phone and look at the QR code with your camera. So you pull up your camera and then it'll take you to a web page where you can not only get the book and it's complimentary, but also you can set up a call with my assistant to have your questions also answered and have a personal one-on-one Zoom call with my assistant as well. Again, we want to provide you all the information, answer all your questions. My assistant is amazing and knows all the information and can even talk about people that want to look at coming out here for an easy 2 or 3 day trip to stay for consultation and the procedure and then fly back home. As you saw on the map, people do this all the time. And it's been like that for well over 15 years. So thank you all so much for being here. And I hope this was very informative for you and helpful. And we'll talk to you soon. Bye-bye.